I'm very concerned about the rise in the numbers, the positivity rate, the cases that we see in Broward County. They continue to go up. Right now, I can tell you that since we reopened our district on October 9th for face-to-face, about 25% of our students have returned for face-to-face in classroom instruction. The number of cases, positive cases that we've documented so far is about 450 cases, and it's been half students, half teachers roughly. I would say to you that based on our preliminary looks at the data, there's no indication that the preponderance of those cases are occurring within the school environment itself, right? So we probably need another 30, 60 days looking at the data, but we know that folks are engaging in activities outside of school, and those are the things that put our school system at risk to remain open, is what goes on in a larger community. So I continue to ask folks in our community to make sure that you are adhering as much as possible to CDC guidelines, especially when it comes to social distancing, especially now that we're coming up on the holidays, Thanksgiving, thereafter followed by the winter break. Those are going to be some crucial times for us, but we're already seeing numbers going up now, but we can't be complacent given where we were, because we see what that's doing.
So the data, your reading of the data shows that schools are not spreading?
Yeah, we don't believe, again, we need to look at the data, but I see no significant indicators that say our schools themselves are significant transmission points for the virus. We put our protocols in place in terms of cleaning, in terms of physical distancing in our schools, and we have only about, I guess, a smaller percentage of students in school, about 25%. So all those things have combined, I believe, to ensure that our schools are as safe as possible. There's no such thing as 100% safe, but they're as safe as possible. The cases that we've documented so far, we work with the Department of Public Health, and we're continuing to work with them through their contact tracing and epidemiologists to track down these things, and we haven't seen anything to date that says our schools are providing significant transmission by being open. Now, again, that risk of that continues to change as we move on into this pandemic and the numbers rise. It continues to be a concern.
So you see that these numbers rising. Is there a point where the district might consider shutting schools down again, or is that not even an option because of the governor's order?
Our ability to shut down schools certainly going to be dictated by the governor's executive orders and where they are relative to the state of the pandemic. With that said, I would say that we've always said that we'll take a very strategic and tactical approach to dealing with this. If we identify specific classrooms where individuals that were infected and tested positive were connected, we have quarantined and isolated folks based on our protocols. If necessary, we'll do entire classrooms. If necessary, we will then go and work and isolate and test entire schools if need be. But in terms of shutting down the whole entire county, I don't believe that we're at a point where we need to consider it at this moment, but that may change as we continue to move forward.
The other benchmarks you've always looked at, you have those 5 criteria. The other things,
yeah.
How are the other criteria going besides the positivity rate?
Some of the other metrics, hospitalization rates, and the ability of our healthcare system to absorb the cases coming in. They've seen a rise in number of cases, but and I just got off the phone with them shortly, they're not at a point where it's unmanageable for them. So that's still a manageable situation for them, but the cases, which is one benchmark, the number of positive cases continues to go up. The positivity rate is significantly higher than where it was when we opened up schools. But one of the other metrics is the district's ability to manage through this, through resources that we have and protocols that we put in place. And I can tell you we've done well with that in terms of our discipline and what we put in schools to make sure that the protocols are in place. So those remain satisfactory at the moment.
Last question. I'm sure these rates going up is going to create more anxiety for teachers. You've already granted a lot of accommodations.
Yeah, we've granted over 1,400 accommodations so far, from what I understand, which is a significant number of accommodations to teaching staff with significant underlying health conditions that put them at risk, based on a list of vulnerabilities that we have received from the CDC. So we are using Center for Disease Control guidance to help support our decisions on that, and that's how we've gone through it. But it's a lot.
I know you and I have already discussed this. We already did a story on this, but I got another email from a teacher who has a son with leukemia. Because now I didn't get the accommodations. I can't believe it. My son has leukemia. Puts me in an impossible situation. I'm going to have to quit. And what do you tell teachers like that?
Yeah, it's really a very challenging situation, and we wish that we could accommodate everyone, but we can't. So from the onset, we were clear we had to prioritize these. We put and created different categories. Our ability to ultimately accommodate everyone was going to be a function of how many people applied and the capacity of the district to continue to provide educational services to our students and our families. If we are going to open schools, which the decision has been made by the district and the state, then we must have teachers available to provide not only instruction, but supervision in the classrooms. We can't open our schools and the students are in the schools and the teachers are somewhere else. And so I definitely understand the concern, but what we've had to prioritize as part of our work, which has been done in our surrounding districts as well, is the employees who directly have health conditions. And we haven't been able to get to the point where we can accommodate individuals who have family members or others that they live with who are impacted at this point. So it's challenging, but we can't accommodate everyone. And I've read all the emails, I've seen all the concerns. We anticipated that, but this is where we are. I will say that I believe that our school environments, we're working to make them as safe as possible. Again, we put our protocols in. We have low density and populations of students in our schools generally. So I think that's helpful.
Stay right there if you would. Good.
My question is, what's been the most challenging part? I feel like we've been at these interviews and this for 6 or 7 months now. With everything that's going on, there's some COVID fatigue. There's people who are willing to wear the mask and do all that. What's been the most challenging part navigating all this for you?
I say there's two things. One of them you asked about earlier, and that's not being able to grant all the accommodations to individuals that request them, because we're just not in a position to do that. That's been very difficult for me and the school board to not be able to do that. But we have a responsibility to our students, our parents and families, that if we're going to open schools, then we must be able to open schools. The second thing is the students who are still out there, who are not engaged to the degree that they should be, that we need to make sure that we connect with. So I worry about them as well.
And do you have everything you need to execute this, or does the state and local officials, is there more that should be done or could be done?
I'm sorry, what's the question?
Just with the state and local officials, do you have everything you need as far as the protocol and know what needs to be done to execute what needs to be done with the schools, or is there more that they need to be doing or can do?
We have everything that we need internally right now in terms of materials, resources that we've been able to put in place. That comes at a significant cost. So what we need from the state, what we need from the federal government that we've been asking for is financial resources to be able to maintain the protocols and supports that we are providing within the school system. So that continues to be a challenge. And as we go forward, we're going to continue to have conversations with the state, our commissioner, through the governor's office. I know the county continues to communicate as well. We'll have to monitor this pandemic and see where we are and how that's going to impact any future executive orders that give us flexibility. But one of the things that we want to be able to do as we go forward is to be able to provide parents the flexibility to choose the learning modality that they want. That is to either send their child to school for face-to-face or keep them home. We want to maintain choice for our parents and families, so we're concerned that that particular right and opportunity not be taken away.
Stay right there for a second.
Yeah.
Get a couple